Hello everyone, my name is Saoane. I'm a PhD student from the University of Melbourne. On behalf of our research team, I'm going to present our work, Key Considerations for the Design of Technology for Enrichment in Residential Aged Care, an ethnographic study. Firstly, I'm going to introduce some background of the study. The adult population who age 65 and over is increasing worldwide. Aging results in physical, psychological, and social changes in the human body, which can include increasing frailty, limiting mobility, and sometimes cognitive decline. In Australia, when other people can no longer live independently in their own homes, they are assessed to be admitted to residential aged care facilities, also known as nursing homes. Over half of other Australians living in nursing homes have dementia. People affected by dementia and other age-related conditions may lose opportunities to take part in meaningful and enjoyable activities. Some people may face increased loneliness due to reduced social networks and increased mobility constraints. This has been exacerbated by visiting restrictions during the COVID-19 pandemic. Those difficulties have significant implications for the psychosocial well-being of residents. In response to these issues, residential aged care facility delivers several different social programs to promote the residents' social and emotional well-being, including some technology-based activities. In this research, we use the term technology for enrichment to refer to technology used in activities as a part of a social program for aged care residents to bring joy and open opportunities for social engagement. Research shows that when used appropriately, technology for enrichment can offer different kinds of social and emotional support. For example, video calling can work well for connecting residents to their loved ones. Virtual reality or VR can give residents the sense that they are traveling to another place or experience new activities. However, although this technology has been found to be valuable for enhancing social and emotional well-being of residents, previous research shows that introducing technology such as VR to this population may encounter some ethical concerns, for example, triggering unpleasant experience. Furthermore, this technology has been found difficult to sustain in the care environment. Therefore, there was a call for further research to have improved its implementation in this environment. And there's a need to better understand the challenges involved in using this technology in these settings. In this work, we conducted an ethnographic study at the Vietnamese Australian aged care facility that supports the goals of the study. The participant observer of Thach was chosen for this study. I obtained permissions from the management to work as a volunteer assisting the activities team in the home. Field notes of observation in formal interviews were the main data collection technique. In our paper, as well in this presentation, we use Lederman to refer to the participants. In the study, we found that the cultural factors play an important role in the life and social well-being of residents in the home. The social activities organized in the home were integrated with and influenced by the Vietnamese culture. People who don't understand about the Vietnamese culture may face challenges to work in this home. As activity staff member, Thach said, previously there was one non-Vietnamese guy who came to work as an activity staff member with us. He organized a lot of activities that have Western styles, similar to other Australian nursing homes, but not many residents were engaged. After a short time, he left the facility. There were also several young guys who came to do the trial work here, but then they left. On one occasion, a resident believed that came from her Vietnamese culture. Many Vietnamese people believe that placing digital communication devices, including smartphones and tablets, on their bedhead is not good, as it would impact their sleep and brain functions. So when seeing I'm walking past her room, resident asked me for a favor. She told me to come to her room, look for a device on her bedhead. I then looked and found that the device was just a handheld controller that was used to adjust the best positions. Based on this finding, we just said that technology for enrichment should be culturally supporting residents. That means it should be able to provide a variety of group experiences that are oriented to the cultural background of residents. For example, integrating culture-friendly content, avoiding things that have negative connotations according to resident cultural beliefs, etc. Our ethnographic study also found that many residents had experienced traumas in their lives, and these traumatic experiences were often recalled with simple triggers. For example, a resident Fu, often told me about her traumatic experience, which led her go into early labor and deliver a son who was born with disabilities. On one occasion, I saw the resident storing a lot of snacks, fruits, and soft drink in her rollator walker storage. I asked about those things, and the resident said, "Those things are for my son. He is living with disabilities. Because I have early labor, during the pregnancy, I climbed a chair to turn on the light, and I suddenly fell. That made me having early labor and deliver him. For him, thinking about him made my eyes fill with tears. I keep this for him." This story was repetitively mentioned by the resident every time she saw me, probably because seeing me as a young male made her miss her son. Another example of recalling traumas is resident Wing, who is from the south of Vietnam. She often told me that she had a traumatic experience related to the death of her ex-husband during the Vietnamese War. In a conversation with me, activity staff member Thach said that resident Wing is sensitive to some words that the community government often uses. He demonstrated by an example. One time, as a CARE staff member doesn't know about resident Wing sensitivity to some special word. The CARE staff asked the resident Wing to borrow a pen but using the word Cán Bộ to refer to herself. The resident was then angry and shouted to the CARE staff that Cán Bộ are those who killed her ex-husband. Meanwhile, previous research showed that technology for enrichment, for example VR, may provoke traumatic experience of other adults. So based on this finding, we suggest that technology for enrichment should be psychologically supporting residents. That means contextual factors that possibly provoke the resident traumas need to be carefully considered. And not all residents are suitable for technology-based experience. In this study, we also found that some residents were enthusiastic about using technology, such as smartphone and tablets. However, they may have limited capacity to use the smartphone and tablets. For example, when seeing carrying an iPad and swiping its screen, Resident Chung suddenly went to his room to take his phone and show it to me. Although it was a non-touchable keyboard flip phone, he tried to use his finger to swipe the screen in the same way that I did. During the volunteering period, I also found some barriers to using technology effectively in the home. For example, some residents in the home don't use technology due to their complex medical conditions. One resident Wing told me that she cannot use the device for longer than half an hour because of her health condition. She said creating tangible objects rather than using technology would help her feel happier and reduce her boredom. Based on these findings, we suggest that technology for enrichment should be physically supporting residents. That means technology should be adapted to be used by aged care residents with tremors and limited movements, as well as other health conditions. During the study, I also brought along a VR headset and asked activity staff if he would like to try it on with my support. He agreed and put the headset on, watching a 360-degree video recording of the Opera House in Sydney. After removing the headset, we had a conversation about the experience. When I asked about the suitability of VR technology for the residents, he said, "This technology is good at letting the residents travel virtually to destinations where they couldn't travel to. It's good with the COVID-19 pandemic. However, I think this might not be suitable for some residents with vision impairments and those with motion sickness. They may not feel well when wearing it. I have just experienced dizziness." This quote indicates that the activity staff members seem hesitant about the technology adoption. It seemed to presume that the residents would experience the technology in the way that he experienced it. As a gatekeeper, he would choose not to introduce the technology that he would believe would incur harm to the residents, suggesting that the first-hand experience of the activity staff member are very important to the decision to adopt VR in the care home. Based on this finding, we suggest that technology for enrichment should be considering the work of aged care staff, especially the activity team, and a collaboration with the activity team in identifying benefits and harms is needed. We illustrate our implication in this slide. For detail about this study, please refer to our full paper in the proceeding of the conference. Thank you very much for your attention.